What if the greatest threat to your health is not the pain you feel, but the silence you ignore? Every day, millions of people wake up, go to work, laugh with their families, and plan for tomorrow, completely unaware that something within them is slowly changing. It does not shout. It does not demand attention. It whispers. Chronic kidney disease remains undetected for so long because it moves quietly through the body, gradually affecting function without dramatic warning signs. This silence can feel comforting, almost reassuring, because we often believe that if something were truly wrong, we would surely feel it. Yet the human body is both resilient and subtle, capable of adapting to decline in ways that mask danger. That is why awareness becomes not just a medical concept, but a mindset. When we understand that health is not only about reacting to pain, but about respecting prevention, we begin to shift from passive living to proactive care. Many people associate serious illness with visible suffering, dramatic symptoms, or sudden collapse. Chronic kidney disease does not usually begin that way. Instead, it may appear as mild fatigue after a long day, slight swelling in the ankles, a small change in urination, or blood pressure that creeps upward without drawing alarm. These signs are easily dismissed as stress, aging, or temporary imbalance. Life is busy, and small discomforts are often pushed aside in favor of immediate responsibilities. But the kidneys, those remarkable organs quietly filtering waste and balancing fluids every second, continue their work even when under strain. They compensate, they adapt, and they endure. It is this ability to compensate that creates the illusion of safety. By the time clear symptoms appear, significant damage may have already occurred. Understanding this reality requires humility, because it challenges the belief that we are always aware of what is happening within us. The philosophy inspired by Dr. Mathew R. Weir encourages us to look beyond obvious symptoms and recognize the power of early awareness. His educational insights emphasize that prevention is not an act of fear, but an act of responsibility. Routine screening, simple blood tests, and urine analysis may not feel urgent when we feel fine, yet they can reveal patterns long before the body signals distress. This perspective transforms health from a reactive crisis response into a deliberate, ongoing commitment. When individuals with high blood pressure, diabetes, or a family history of kidney disease choose to test regularly, they are not assuming the worst. They are choosing knowledge over uncertainty. Knowledge creates options, and options create control. Without awareness, we surrender our health to chance. With awareness, we step into partnership with our own well-being. The silence of chronic kidney disease teaches an important life lesson. Not all danger announces itself. In many areas of life, whether personal growth, relationships, or career development, neglect often begins quietly. Small habits accumulate. Minor oversights compound. Consequences grow gradually. Health follows the same principle. When routine checkups are postponed year after year, when subtle changes are ignored, when risk factors are left unmanaged, progression becomes almost invisible. Yet this invisibility does not mean harmlessness. It simply means time is passing without intervention. The good news is that early detection can dramatically alter the trajectory. Lifestyle adjustments, medication, dietary changes, and careful monitoring can slow progression and protect remaining kidney function. Early awareness preserves quality of life and reduces the likelihood of late-stage kidney failure. To confront a silent disease requires courage of a different kind. It requires the courage to test when you feel fine, to ask questions when there is no obvious crisis, and to act before urgency forces action. It demands discipline, because prevention rarely provides immediate dramatic rewards. The reward is long-term stability, strength, and resilience. When we embrace proactive health, we send a message to ourselves that our future matters. Chronic kidney disease remains undetected for so long, not because it is unstoppable, but because silence can be deceptive. By shifting our mindset from symptom-driven care to awareness-driven care, we reclaim control. The body speaks in subtle signals long before it cries out. Learning to respect those signals is not fear, it is wisdom. There is a deeper reason this silence persists, and it lies in the way human nature responds to comfort. When there is no sharp pain, no emergency room visit, and no dramatic interruption of daily life, we convince ourselves that everything must be stable. We measure health by how energetic we feel in the morning or how productive we are during the day. Yet the kidneys do not demand attention in obvious ways when they begin to struggle. They continue filtering blood, balancing electrolytes, and regulating fluid with remarkable endurance. Even when function declines gradually, the body adapts so efficiently that the warning signs blend into ordinary experiences. A slight headache becomes stress. Mild swelling becomes fatigue. Changes in appetite become routine fluctuations. In this quiet adaptation, the illusion of safety grows stronger. This is why education matters so profoundly. Awareness disrupts illusion. When people understand that kidney function can decrease significantly before symptoms become severe, they begin to see routine testing not as an optional task, but as a protective strategy. Blood pressure readings, estimated glomerular filtration rate calculations, and urine protein checks may seem technical, yet they are powerful tools that reveal truths hidden beneath comfort. Inspired by the preventive philosophy often associated with Dr. Mathew R. Weir, we are reminded that knowledge is not meant to create fear, but to inspire responsibility. Taking control of your health through early screening reflects respect for your future self. It is an act of maturity, discipline, and long-term thinking. Many individuals at higher risk, especially those living with diabetes or hypertension, underestimate how closely these conditions are linked to kidney health. Elevated blood sugar and high blood pressure quietly strain delicate filtering structures over time. The damage does not announce itself with dramatic symptoms at first. Instead, it accumulates gradually, layer by layer, year by year. This progression mirrors many aspects of life where neglect compounds silently. Financial debt grows with small unchecked expenses. Relationships weaken through unaddressed misunderstandings. Physical strength declines without consistent care. In the same way, kidney function diminishes when risk factors remain unmanaged. The lesson is not to panic, but to recognize patterns early enough to redirect them. There is also a psychological barrier that contributes to delayed diagnosis. People often avoid testing because they fear bad news. They prefer uncertainty over confirmation. Yet uncertainty does not protect health. It merely postpones clarity. True strength lies in confronting reality before it becomes overwhelming. When kidney disease is detected in its earlier stages, treatment options are broader and outcomes are significantly better. Lifestyle changes, medication adjustments, dietary modifications, and careful monitoring can slow progression and preserve function for many years. Early detection transforms a potential crisis into a manageable condition. It shifts the narrative from helplessness to empowerment. The silence of chronic kidney disease is not an enemy designed to defeat us. It is a challenge inviting awareness. It asks us to move beyond reactive living and adopt a proactive mindset. It calls us to listen not only for loud alarms, but also for subtle signals. Health is not guaranteed by the absence of discomfort. It is sustained by consistent attention, informed decisions, and preventive action. When you choose routine screening, even when you feel well, you are investing in stability. You are choosing foresight over complacency. You are honoring the intricate systems within your body that work tirelessly every moment. And in that decision, you transform silence from a hidden threat into an opportunity for wisdom, vigilance, and lasting strength. True transformation begins the moment you accept that prevention is a daily discipline rather than an emergency reaction. Chronic kidney disease does not develop overnight, and neither does resilience. Each healthy choice, each scheduled checkup, each moment of awareness becomes a quiet investment in longevity. The tragedy is not that this condition is silent. The tragedy is that silence is often misunderstood as safety. When people finally receive a diagnosis at an advanced stage, they are frequently shocked, asking how something so serious could exist without louder warning. The answer lies in gradual progression. The kidneys are remarkably adaptable organs. They compensate for lost function by working harder, maintaining balance even under strain. But compensation has limits. When those limits are reached, the decline that once seemed distant can accelerate rapidly. Imagine driving a vehicle with a slow leak in one tire. At first, everything feels normal. The car moves forward smoothly, and there is no obvious sign of danger. Over time, however, the pressure drops steadily. If no one checks the gauge, the tire eventually fails. Not because the damage was sudden, but because it was ignored. Kidney health follows a similar principle. Monitoring blood pressure, managing blood sugar, staying hydrated, maintaining a balanced diet, and avoiding unnecessary strain from certain medications are like checking that tire regularly. They are simple habits, yet their impact compounds over years. Inspired by the preventive mindset associated with Dr. Mathew R. Weir, we understand that medicine is not only about treatment, but about foresight. Prevention requires patience because its benefits are not immediately visible, but its power lies precisely in that quiet protection. There is a moment in every health journey when awareness either deepens or fades. Some individuals hear about kidney disease and assume it will affect someone else. Others pause and reflect on their own risk factors. That pause can be life-changing. When someone with hypertension chooses to monitor their readings carefully, when a person with diabetes commits to tighter glucose control, or when a family member with a history of kidney disease schedules routine testing, they are making a conscious decision to disrupt silent progression. They are refusing to let comfort replace caution. This is not living in fear. It is living with intention. The suspense surrounding chronic kidney disease lies in its unpredictability when left unchecked. Years can pass with minimal discomfort, creating a sense of stability. Then, subtle symptoms intensify. Fatigue deepens. Swelling becomes more noticeable. Lab results reveal significant decline. At that point, options may feel more limited. The earlier stages offered flexibility and time, but time was not fully used. This possibility should not create anxiety. It should inspire urgency. Urgency does not mean panic. It means recognizing that action today prevents crisis tomorrow. Health is a partnership between awareness and action. The body provides signals, sometimes faint, sometimes strong. Medical science provides tools for measurement and guidance, but the individual must choose engagement. No one else can prioritize your screening appointments or manage your daily habits. That responsibility belongs to you, and within that responsibility lies empowerment. When you understand that early detection can slow or even halt progression, you begin to see testing not as a burden, but as protection. Chronic kidney disease remains undetected for so long because it thrives in neglect, not because it is invincible. Silence is powerful only when it is ignored. Once acknowledged, it loses much of its threat. Through routine checkups, disciplined management of risk factors, and a commitment to lifelong awareness, you reshape the narrative. You replace uncertainty with knowledge, vulnerability with preparation, and complacency with vigilance. The journey toward kidney health is not dramatic, but it is profound. It is built on steady choices, informed decisions, and the courage to look beneath the surface, even when everything appears fine. In that courage, you safeguard not only your kidneys, but your future, your energy, and your quality of life for years to come.